You can feel fine all day long and still have your kidneys, nerves, and heart wrestling with high blood sugar every single night while you sleep. More than 500 million adults around the world are living with diabetes right now, and a huge portion of them have no clue yet because early on, the body tends to whisper at night rather than shout during the day. Those whispers show up as bathroom trips, strange leg sensations, night sweats, heartburn, nightmares, morning headaches, and most folks brush them off as age or stress. If this kind of straight, no-nonsense health talk is helpful for you, hit subscribe and tap the like button. Here on Dr. Waterling, the target is 300,000 subscribers, and your click genuinely moves us closer. I also share practical checklists and short health tips over on my Telegram channel, and the QR code for that is right there on your screen. Every night while you sleep, your body runs a quiet balancing act between sugar in the blood, hormones, and your nervous system. In normal metabolism, your pancreas releases just enough insulin to move glucose from the blood into cells, your liver stores and trickles out a steady supply of fuel, and your nerves and blood vessels get a calm maintenance shift. With prediabetes and type 2 diabetes, that whole system gets noisy. Sugar runs high, insulin gets overproduced, organs get overstimulated, and night is often when the first warning lights begin to flash. You are about to hear 15 of those nighttime signals. None of them alone proves diabetes, but when you spot several at once, that is something to bring up with a doctor instead of pinning on getting older. One of the earliest signals is getting up to pee several times a night. In medicine, that pattern has a name, nocturia, which simply means frequent urination during the night. For most healthy adults, 0 or 1 bathroom trip in the night is typical. Once you are up 2, 3, or more times on a regular basis, your kidneys may be working overtime to dump extra sugar. When blood glucose climbs above the kidney's reabsorption threshold, the tiny filters inside the kidney cannot pull all that sugar back into the blood, so glucose spills over into the urine. Glucose acts like a magnet for water, so it drags fluid along with it. Your bladder fills faster, and you end up waking again and again to empty it. There is a case described in clinical practice of a man who was getting up about 10 times every night to urinate, convinced it was just his prostate or his nerves. When his blood work was finally checked, his sugars and insulin were clearly off. He cut back hard on fast carbohydrates with his clinician's guidance, and within roughly a week, his nightly bathroom trips dropped to a level where he could finally sleep. That is not magic. That is physiology settling down once you stop pushing sugar through the kidneys all night long. At the same time, keep in mind that frequent night urination can also stem from heart failure, diuretics, or prostate enlargement. So this is precisely the kind of symptom that calls for a proper medical workup, not self-diagnosis. The second night signal is intense thirst that keeps yanking you out of bed. When you lose liters of fluid through sugary urine, you end up mildly dehydrated, and your brain does what it should. It makes you desperate for water. But there is another layer here too. Chronically high blood sugar makes the kidneys hang on to sodium, the main component of salt. And wherever sodium goes, water follows, which keeps your fluid balance on a knife edge and your thirst switch half stuck in the on position. While all this is going on, you are not just losing plain water. You are also flushing out electrolytes like potassium, magnesium, and calcium, which are minerals your heart, muscles, and bones depend on to work properly. Potassium is essential for the heart's electrical rhythm. Magnesium helps your nerves and muscles relax, and calcium is central to bone strength and muscle contraction. That mix, too much sodium, not enough potassium and magnesium, sets up a whole extra layer of symptoms that often appear right when you are trying to sleep. The third sign is restless leg syndrome. You lie down, you want to sleep, but your legs seem to have their own plans. The feeling is not quite pain, not exactly itch, more like a deep crawling discomfort or a buzzing that only eases when you keep moving your legs. This problem shows up more in people with diabetes and nerve issues, and it usually gets worse in the evening. One reason for that is the way high sugar burns through vitamin B1, also known as thiamine, which your cells use to burn glucose cleanly for energy. When thiamine runs low, your muscles switch over to less efficient chemistry and start building up more lactic acid, a byproduct that leaves muscles feeling tired and wired at the same time. Add in the magnesium loss we just talked about, and you have a perfect recipe for muscles that can contract but struggle to release, because calcium tells a muscle fiber to squeeze and magnesium is what lets it let go. In practice, many people with these night leg sensations find that talking with their doctor about checking vitamin B1 and magnesium and about using well-absorbed forms like magnesium glycinate in appropriate doses can ease symptoms. But if the diet stays loaded with sugar, the problem tends to creep back. The fourth signal is peripheral neuropathy, nerve damage in the feet and lower legs. That phrase simply means that the long nerve fibers running out to your toes are getting injured. It often starts with burning, tingling, pins and needles, crawling sensations, or feeling like your socks are bunched up when they are not. Some people describe their soles as being on fire. Others notice the opposite, a strange numbness where they cannot feel temperature or light touch correctly. Those symptoms often hit hardest at night, when you finally stop moving and start noticing your body. And when lying flat slightly cuts blood flow to small vessels feeding those already stressed nerves. Chronically high blood sugar damages nerves in two big ways: by starving them of oxygen through damage to small blood vessels, and by a chemical process called glycation, where excess sugar sticks to proteins and warps their structure so the nerve fibers literally break down over time. Large studies show that peripheral neuropathy is among the most common complications of diabetes, affecting up to about half of people over the course of the disease, and the burning and shooting pain usually gets worse at night. That is why any burning, numbness, or loss of sensation in your feet is a do not wait reason to get checked. This is the very stage at which better blood sugar control can slow or stop further nerve damage, even though it cannot fully reverse damage that is already there. The fifth nighttime sign is painful leg cramps that drag you out of sleep. This is not mild stiffness. This is the kind of sudden calf or foot spasm that turns the muscle to stone, forces you to jump out of bed, stretch, and sometimes shout. Once again, the chemistry traces back to magnesium. When high blood sugar makes you lose magnesium through your urine, the balance between calcium and magnesium inside muscle cells gets thrown off. Calcium pours in and says contract, but there is not enough magnesium around to signal relax, so the contraction locks into a cramp. Many people in this situation hear about magnesium and grab the cheapest magnesium oxide tablets, which are poorly absorbed and mostly act as a laxative. Forms like magnesium glycinate or magnesium citrate are absorbed better and tend to act more on muscles and the nervous system than on the intestines. But any supplement plan is something you should build together with your healthcare provider, especially if you have kidney or heart problems. Even then, if you do not also bring down the excess sugar in your diet and tackle the underlying insulin resistance, the night cramps tend to keep returning because you are pouring out the very mineral you are trying to put in. The sixth signal is night sweats that do not match the room temperature. You wake up with a damp pillow, wet hair, soaked pajamas, even though the bedroom is cool and your partner is sleeping comfortably. High blood sugar keeps the body locked in a low-grade stress mode, pushing the fight or flight branch of your nervous system, called the sympathetic nervous system, to stay more active than it should. That drives up stress hormones like adrenaline, which among other things ramps up sweating as if you were running or in danger, even though you are simply lying in bed. On top of that, some people swing the other way at night and drop their blood sugar too low, especially if they take glucose-lowering medications. That nighttime hypoglycemia, low sugar, is also famous for causing sweating, a pounding heart, and suddenly waking up feeling panicked or disoriented. Research on nocturnal hypoglycemia in people treated for diabetes shows that symptoms can include wet sheets, morning headaches, intense fatigue on waking, and sometimes vivid nightmares. If you recognize that pattern, that is not something to self-treat with snacks alone. It is worth a detailed conversation with your diabetes team about medication timing, doses, and nighttime monitoring. The seventh signal is obstructive sleep apnea, which is when your breathing repeatedly stops and starts during the night. You may not notice it yourself, but your partner may hear loud snoring, then a stretch of silence, then a choking or gasping sound as you start breathing again. Sleep studies show that this can happen dozens or even hundreds of times per night, and it is strongly tied to both type 2 diabetes and prediabetes. The link runs both ways. Chronic overfeeding, especially with sugar and refined carbs, pushes the pancreas to pump out more insulin. Over time, your cells stop responding well, which is insulin resistance. Insulin is also a storage hormone that drives fat buildup, particularly around the belly and neck. Extra tissue in the neck narrows the airway and makes it easier for the throat to collapse during sleep when the muscles relax, which is exactly what happens in obstructive sleep apnea. Meanwhile, every apnea episode drops oxygen levels, stresses the heart, spikes blood pressure, and further worsens insulin resistance, building a vicious circle. Large reviews show that people with untreated sleep apnea carry much higher risks of heart attack and stroke over time. So if you wake up unrefreshed with morning headaches and your partner says you stop breathing or gasp in your sleep, that is a strong reason to ask your doctor about formal sleep apnea testing, particularly if you also carry extra weight or have high blood sugar. The eighth signal is high fasting blood sugar in the morning, even though you did not eat anything overnight. Many people check their sugar at home, see a high number first thing, and think, how can this be? I stopped eating after dinner. What you are seeing is often the quote-unquote dawn phenomenon, where hormones like cortisol and glucagon naturally rise in the early hours to help you wake up, telling the liver to release stored glucose into the blood. In someone with normal insulin sensitivity, that rise stays modest because insulin quickly tells the liver, that is enough, stop now. When the liver becomes resistant to insulin, which usually goes hand in hand with fat buildup inside the liver cells, known as fatty liver or hepatic steatosis, it stops listening to that stop signal. The liver keeps pushing sugar into the bloodstream even when levels are already normal or high. So you wake up with elevated fasting glucose without having eaten a bite. Studies on aging and insulin secretion show that as people get older, both insulin resistance and subtle defects in insulin release become more common, which is one reason fasting sugars creep up with age, even in people who feel they have not changed their diet much. Supporting liver health and improving overall insulin sensitivity through weight loss, movement, and dietary changes supervised by a clinician can help calm that dawn effect over time. The ninth signal is almost the opposite, sharp drops in sugar in the middle of the night. In certain stages of insulin resistance, the pancreas overshoots and pumps out a lot of insulin, which can sometimes push sugar down too far, too fast, especially if you went to bed after a high-carb meal or are on glucose-lowering drugs. When blood sugar dips too low, the brain, which leans heavily on glucose, sounds the alarm by triggering a burst of adrenaline that tells the liver to dump more sugar into the bloodstream. That adrenaline surge is what jolts you awake with a pounding heart, shaking hands, sweating, and a sudden feeling of fear or panic around 2 or 3 in the morning. Then, by early morning, the liver has done its job, your sugar rebounds, and you may actually sleep more deeply right before the alarm goes off, and wonder why you feel so wrecked when you finally drag yourself out of bed. That pattern of middle of the night crashes and rebound morning highs is another thing to review with a doctor, especially if you are already being treated for diabetes or pre-diabetes. The 10th nighttime clue is that you simply cannot fall asleep at a reasonable hour, even when you are exhausted. You lie in bed at 11, midnight, 1 in the morning, and your body just refuses to switch into sleep mode. High blood sugar interferes with the normal production of melatonin, the main sleep hormone released by a tiny structure in the brain called the pineal gland. In a healthy rhythm, melatonin starts climbing after dark and reaches a level by around 10 or 11 at night that makes you feel drowsy. With disrupted glucose metabolism, that curve shifts later. So your melatonin rise is delayed, you catch a quote-unquote second wind, and you finally fall asleep in the small hours, then feel destroyed in the morning. This matters because chronic sleep loss and irregular sleep schedules themselves make insulin resistance worse and raise the risk of developing type 2 diabetes, so it becomes a self-reinforcing loop. There is a pattern described in primary care where someone in their 40s or 50s starts with late bedtimes and trouble falling asleep, then a few years later turns up with rising fasting sugar, extra belly weight, and borderline blood pressure. The lifestyle pattern and the lab changes almost always travel together. That is why sleep timing and light exposure are not quote-unquote soft wellness issues. They are part of real metabolic treatment plans in modern endocrinology. The 11th signal shows up as nighttime heartburn or acid reflux. You lie down and feel a burning behind the breastbone, a sour taste in your mouth, or the need to prop yourself on several pillows just to keep acid from creeping up. People often pop antacid tablets for years without asking why it is so much worse at night and why it keeps coming back. Chronically high blood sugar can damage the autonomic nervous system, the automatic wiring that controls things like heart rate, digestion, and the little muscular valves inside your digestive tract. One of those valves is the lower esophageal sphincter, the ring of muscle between your esophagus and your stomach. When its nerve supply gets impaired, it may not close properly, letting acidic stomach contents splash back up into the esophagus more easily, especially when you lie flat. Late night eating makes this worse because your stomach is still full when you get into bed, and meals heavy in sugar and refined carbs can crank up acid production and slow stomach emptying. For many people, not eating for 3 or 4 hours before bed and cutting back on fast carbs in the evening are very reasonable steps to bring to a doctor or dietitian as part of a reflux plan, especially if there is also concern about blood sugar. The 12th signal is a run of vivid, often unpleasant dreams or full-blown nightmares that feel too real. You wake up in a cold sweat, heart racing, and for a few seconds it is hard even to tell the dream from reality. Brain cells talk to each other using chemicals called neurotransmitters, and one of the key ones for sleep stages is acetylcholine. To build acetylcholine, the body needs vitamin B1, the same thiamine we already talked about with restless legs. When a high sugar diet steadily drains B1, the balance of neurotransmitters can shift, and the brain may fire in a more chaotic way during dream sleep, leading to intense, disturbing dreams. There are reports from clinical practice where people with a high carb diet, blood sugar issues, and frequent nightmares started targeted vitamin B1 under medical supervision and saw their dreams settle down within a week or two. That does not turn nightmares into a vitamin deficiency test, but it does show how tightly nutrition, glucose, and brain chemistry are tied together. If you have persistent, scary dreams along with other signs from this list, it is reasonable to raise all of that with your clinician rather than just chalking it up to stress. The 13th signal is high blood pressure at night that does not dip the way it should. In a healthy pattern, blood pressure drops by about 10 to 20% while you sleep, giving your heart and arteries a break. In people with insulin resistance, diabetes, or sleep apnea, that drop often does not happen. Pressure stays high or even creeps up toward morning, a pattern called non-dipping. Several mechanisms feed into this. Insulin resistance and high insulin levels make the kidneys hang on to more sodium and water, which directly raises blood pressure. Sleep apnea triggers repeated spikes of stress hormones every time breathing stops and restarts, tightening blood vessels over and over during the night. On top of that, the same overactive sympathetic nervous system that drives night sweats and jaw clenching can keep arteries in a constant half-squeeze state. Research following people with hypertension and diabetes shows that those whose blood pressure does not fall at night carry roughly double the risk of heart attack or stroke compared with those who have normal nighttime dipping, independent of their average daytime pressure. That is why doctors sometimes order 24-hour blood pressure monitoring instead of relying only on office readings. It reveals a whole hidden landscape of nighttime strain. The 14th sign is grinding or clenching your teeth in your sleep, known as bruxism. You may wake with sore jaw muscles, a dull headache, or notice over time that your teeth are getting flatter while your dentist points out worn enamel. Partners often report loud grinding noises at night, sometimes loud enough to be heard in the next room. This is another place where chronic metabolic stress shows up as muscle tension. When sugar runs high and the stress system stays switched on, levels of hormones like adrenaline and cortisol stay elevated, and muscles throughout the body, including the chewing muscles, hold more tone instead of fully relaxing. Over years, this can damage teeth and the joint where the jaw meets the skull, which is why dentists often prescribe night guards. Those protect the teeth from wear, but do not change the underlying pattern of muscle overactivation and metabolic stress. If you have unexplained bruxism plus other signs of insulin resistance, that is a good reason to coordinate between your dentist and your medical team instead of treating it as a totally separate issue. The 15th nighttime clue is the classic sugar hangover headache in the morning. You wake up with a heavy, throbbing head or a tight, band-like pressure, even when you think you slept enough hours. One big driver is dehydration. While your kidneys were busy flushing excess glucose all night, they also pulled out a lot of water, and even a small percentage drop in total body water can give the brain a headache. If you also had apnea episodes or non-dipping blood pressure, then your brain spent the night with repeated dips in oxygen and pressure spikes, which adds to that morning fog and pain. Simply chugging plain water sometimes is not enough, because without electrolytes like sodium, potassium, and magnesium, much of that water just runs straight back out through the kidneys. Many clinicians suggest for appropriate patients using simple homemade electrolyte mixes with a pinch of mineral or sea salt and a squeeze of citrus. But even something as basic as adjusting morning hydration is worth planning with your doctor if you have heart, kidney, or blood pressure concerns. More important than the quick fix, though, is recognizing that if you routinely wake up with headaches, plus nighttime urination, thirst, and fatigue, your whole metabolic system deserves a closer look. All of these nighttime clues become more common after your mid-40s. As we age, cells naturally get a bit less sensitive to insulin, and the beta cells in the pancreas that make insulin do not always keep up as well, which is why type 2 diabetes is so common in older adults. That is also why guidelines press for more aggressive blood sugar screening once people are in that age range, or have other risk factors like extra abdominal weight, family history, high blood pressure, or high cholesterol. Here's the part where you can start turning information into action without self-prescribing. First, it makes sense to look honestly at all 15 signals and ask yourself how many fit your last few weeks of sleep. If you can clearly say yes to 3 or 4 of them, for example, frequent night urination, night thirst, burning in the feet, loud snoring, or morning headaches, that is a strong argument for getting some basic lab work rather than waiting to see if it passes. Second, there are 3 lab tests that are especially useful to discuss with your clinician if you recognize yourself in this picture. One is fasting blood glucose, measured after you have not eaten for at least 8 hours. Most guidelines treat values in the 90s in milligrams per deciliter, which is around 5.6 millimoles per liter or lower, as truly normal, and levels above that may point toward prediabetes, depending on the exact number and context. The second is fasting insulin, which tells you how hard your pancreas is working to keep sugar in range. High normal or elevated fasting insulin suggests insulin resistance, even when glucose is still borderline. The third is hemoglobin A1C, sometimes called glycated hemoglobin, which reflects your average blood sugar over roughly 3 months and is not thrown off by what you ate last night. Bringing those numbers along with a list of your nighttime symptoms to your appointment gives your doctor a lot more to work with than "I feel tired." Third, food. Almost every mechanism you just heard about gets better when you stop flooding the system with fast carbohydrates. Things like white bread, pastries, sugary drinks, candy, and big portions of white rice or pasta, especially late in the day. Research consistently shows that cutting back on refined carbs, reducing added sugars, and shifting toward whole, fiber-rich foods helps improve insulin sensitivity and lower average blood sugar. One very reasonable plan to bring to your doctor or dietitian is no large carb-heavy meals within 3 or 4 hours of bedtime, and a gradual shift toward more vegetables, whole grains, healthy fats, and protein earlier in the day. Fourth, Think about the micronutrients that keep your nerves and muscles calm. Many people with nighttime cramps, restless legs, or nightmares benefit from talking with their clinician about checking magnesium status and vitamin B1, and about whether trying better absorbed magnesium forms, such as magnesium glycinate, and a supervised course of thiamine makes sense in their case. Some notice changes in leg discomfort or dream intensity within just a week or two when those deficiencies get corrected. But again, supplements work best as part of an overall plan to improve sugar control and should always be tailored to your kidney function and other medical conditions. Fifth, if there is any hint of sleep apnea, loud snoring, choking sounds at night, pauses in breathing, or extreme daytime fatigue, that deserves its own focused conversation with a sleep specialist. Modern treatment options like continuous positive airway pressure devices, dental appliances, and weight loss programs can sharply cut the nightly oxygen roller coaster and, in turn, improve blood pressure and insulin resistance. Untreated apnea is not just annoying snoring. It is a nightly strain on the heart, brain, and metabolism. There is one more big piece of good news. For many people caught early, type 2 diabetes and prediabetes are not a one-way street. Large trials have shown that significant weight loss and sustained lifestyle changes can push type 2 diabetes into remission in a meaningful share of patients, especially when started near the time of diagnosis. That means there is a window where changing how you eat, move, sleep, and manage stress can normalize your numbers and keep your nerves, kidneys, eyes, and heart from sliding into permanent damage. But that window is much easier to use if you listen to these nighttime signals instead of ignoring them for years. Now I want you to think about one simple factor that shapes all of this: your age. After around 45, insulin sensitivity naturally drifts down, blood vessels stiffen, and nighttime blood pressure patterns change, which is why two people with the same habits can have very different risks just based on age. How old are you? Your age changes how aggressively you and your doctor may want to screen, how tight to aim for with blood sugar, and how hard to push lifestyle changes versus medications. So share it in the comments if you are comfortable, and pay attention to how many of these signals you already see in your own decade of life. If you recognize yourself in this video, your next step is not to panic and not to run to the pharmacy alone. It is to use this information to have a sharper conversation with a professional who knows your full history. Make a simple written list of any nighttime urination, thirst, leg symptoms, sweats, snoring, reflux, nightmares, jaw clenching, headaches, and your usual sleep and meal schedule, and bring it to your next appointment. Ask about checking fasting glucose, fasting insulin, and hemoglobin A1C, and ask whether changing your evening meals, sleep timing, and possibly adding targeted nutrients like magnesium or vitamin B1 would be appropriate for you. From there, you and your doctor can decide together whether you are in the zone of prevention, early reversal, or treatment, and you will not be guessing based only on how you feel. Everything here is meant to give you clearer questions and better context, not to replace individualized medical advice from someone who can examine you and read your lab results. If this gave you something concrete to think about, subscribe and leave a like. That is how Dr. Waterling keeps growing toward the goal of 300,000 subscribers. I also keep a steady stream of checklists and short practical health posts on my Telegram channel, and you can jump in anytime by scanning the QR code that is on your screen right now.